Thank you, Jennifer, and thank you for everyone who took some time out of a very busy schedule. I know as a nursing faculty member myself that schedules are very tight, so I'm very honored that you're taking a few minutes of time today to just take a time out and learn a little bit more about maybe flipping the nursing classroom and the book. I feel like I should introduce myself a little bit. I'm a Colorado native. Got both of my undergrad BSN and my family nurse practitioner master's degree at the University of Nebraska Medical Center for any Husker fans on the line. And then came back to Colorado and got my PhD in nursing research from the University of Colorado Health Sciences Center. So I've been teaching even as a grad student, so a very, very long time, and have made a lot of mistakes, and I feel like that is a really good place to be because that allows me to be able to teach others how to avoid those mistakes. And that's really one of the biggest impetuses behind the book. I've done some research in nursing education, mostly on interactive PowerPoints that I have created in the context of cognitive load theory, which I just love cognitive load theory. If any of you are needing something, some extra reading, which I'm sure maybe you do not, but if you do, cognitive load theory really makes a whole lot of sense in what we're doing with nursing education, and so I've really been studying that quite a bit with my research. And more recently here, related to the text, I'm studying student views about flipped learning and how faculty can better prepare students for this pedagogy, and that has been a real eye-opener. It's been a qualitative series of kind of focus groups and interviews, and I've been learning a lot from our student population. And isn't that how it usually is? We certainly can learn a lot from our student population. So I get a question a lot, what exactly is the flipped classroom? And I've created this little schematic that you're looking at on the PowerPoint there about what the traditional classroom is versus what the flipped classroom is. And essentially, the idea is to flip the tasks that the student would be doing at home, moving those tasks into the classroom where instructors are there to guide the students, answer their questions, and actually do what we are all here to do, teach the students. Then we would move the more seat time lecture to what they would do outside of the classroom at home. So the idea is that we want to use the time that we have face-to-face with students in the most efficient and effective way that we can to augment their learning. Aaron Sams and John Bergman are two high school teachers that developed the term flipped classroom and really started to talk about it and write about it. And they actually are Colorado natives as well from Woodland Park High School. Now, of course, they've moved on and they are international experts in the flipped classroom. I'm so thankful that John Bergman took a few minutes out of his busy schedule to write the foreword of the book. It's really quite an honor. Talking about how this makes a whole lot of sense for nurses. And interestingly enough, John Bergman's wife is a nurse. And I've had some great conversation with her on the phone about, boy, nurses get it. Nurses really understand this method because we want to be side by side with our students, much like we are in the clinical setting, helping them maybe through a procedure. We can do that same sort of thing in the classroom, helping them through the things that they are struggling on while they are with us rather than when they are at home. So moving on, thinking about how flipping is a little bit different than just using interactive learning within the classroom. It's interesting that a lot of people that have attended my educational sessions and workshops on the flipped classroom have made the comment to me, hey, you know what, this is all great, but I've been using this strategy for years, probably, you know, before you even decided to become a nurse, which I am very respectful of. However, I think that there's a little bit of a difference in that the lecture is moved out of the classroom in the true flipped classroom into the student's home so that they can move through the lecture, gather some questions, maybe even watch the lecture more than once, stop the lecture so that they can write something down, stop the lecture if perhaps they're an English as a second language student and they're having a hard time understanding a word that the instructor has said. They have time to stop that video lecture, look it up, write it down, gain a better understanding. All those sorts of pieces are really important in the flipped classroom because we're taking that more rote memorization where we're having the students be less active and really less engaged and more just sitting and trying to learn from the sage on the stage at home. And we're using all of the class time for more interactive learning where we can begin to not only teach but assess learning of our students individual within the classroom, and that takes a special kind of technology that has not become available until recent years. So I think that we're in a great stage, a great time period for teaching, because we've got all of these wonderful technological devices and programs at our fingertips that can really help us do what we want to do, and that is help students learn. So the flipped classroom in nursing text, why? Why did I decide to write a flipped text for nurses? It seemed like I went to and actually did a lot of presentations on the method. I talked to people about how I did it and how I thought they should do it. And I was reading the literature and only finding a few small sample size studies out there and a lot of information on how people implemented or how not to implement. But there wasn't a whole lot of research. There wasn't a manual or a how-to guide, like, hey, think about this before you do that, you know, a step-by-step, almost procedure. When we think about putting in an IV or something, we don't just run up and stab the patient. We have to think about it in a really sequential way and in a way that is thoughtful so that we do the procedure correctly. So the faculty that I was working with at the conferences, where I did all the podium presentations and the workshops and things like that, kept saying to me over and over and over, this is great. We like your handouts. We like that you presented on it, but we want a manual. Can't you, like, give us a manual? Give us a how-to guide. We need something to help us from day to day. Like, I'm going to forget what you told me today. I'm just like the student in the lecture, and I want to be able to have something that I can flip through pages and understand. Hence the book. So I wanted to try to fill a gap and also help people learn about the method from some of my mistakes. So you might be asking yourself, what's different about this book? I mean, why should I maybe even look into this book? There are a couple of other flipped learning books out there, which I have read them all. Trust me, they're great. The one thing that I saw that was missing was that they weren't specific to nursing education. And as you all know, I think they were very unique in that we are a practice discipline. If we do, you know, if our student does a math problem wrong, you know, they might miscalculate something, but if our students do a procedure wrong, they might hurt somebody. So I think that we are really very thoughtful about how we teach students. So this book is specific to nursing education and speaks only to nursing education. It's written by a nurse educator, and it's written for you, the nurse educator. And I'll be honest, I think anybody who knows me well knows that I am a true confessions kind of person. I am who I am. Like our good old Popeye said back in the day, I just like to say, hey, you know what, I'm not perfect. I didn't do everything correctly. In fact, I jumped in with both feet with flipping and really had a terrible experience. It completely blew up on me, and it taught me some really wonderful, valuable lessons that I want to share with others. So there are real stories in the book. I think they're sort of entertaining stories. I always say to people, I don't like to read things that are boring, so I do not write things that are boring. I have to have a little bit of humor in my day to make things more survivable. And so there's real stories, practical applications, and these are all from nurse faculty who are flipping or have flipped, not just myself, but other faculty as well. So how about the text? There are 9 chapters, all focused on different aspects of flipping the classroom that I thought were those sequential steps, those procedural things that we need to think about. So moving on to look at the actual chapters to just give you an idea of the overview of the chapters. Chapter 1 is why flip the nursing classroom, and I really like this chapter because have you ever had a soapbox? Do you ever have this thing that you feel really passionate about? Well, the great thing was I was able to write something that I felt really passionate about. I really feel like nursing education needs a revamp. I feel like we need to be open to some fresh and new ideas, and we need to think about teaching in a different way. And so I really have taken that chapter to champion the flipped method for the nursing classroom. The second chapter was really developed not because I love to look through evidence-based research, although it is very helpful. What I wrote that chapter for are all of the people that would come up to me at the conferences and say, where's the evidence that this works? As good nursing instructors should, where is the evidence that says this is any better than lecture? Which I always used to say, So you show me the evidence that says lecture is working really well, and then I'll show you the evidence that says that flip's working really well, because there's not a whole lot of research on either side of those fences. So what I did was try to take all of the evidence that I could find on the flipped method, not just in the nursing classroom, but just overall on flipping, and then try to use that in levels of research to show what actually has been done. And as you might imagine, the end of that chapter is talking about, gosh, we need to do more. So please think about putting some research out there yourselves. Chapter 3 is the intentional instruction model, and the first rendition of that model, myself and my colleague Kat Johnson, developed for our viewpoint of looking at the flipped classroom, and then I revised it for the text after learning some more lessons in flipped learning. And it is sort of a step-by-step schematic on how to think about instruction with the flipped classroom in nursing. So I'll show you that in a slide or two here. Chapters 4 and 5 are talking about preparation. So when I first wrote the text, I wrote that together, and the chapter was becoming so large and kind of cumbersome, I thought, wait a minute, we have to prepare ourselves, and then we have to think about preparing our students. So it became split into 2 different chapters. Number 6 is offload content. What do we want the students to do before they come to class? Number 7, oh boy, now what? Now we have them in the class and we have all this time with them, and we're not going to lecture, so what are we going to do? So chapter 7 talks about that. Chapter 8 is really looking at the evaluation step. Did it work? And then trying to see how we can revise it. And then chapter 9 is perhaps, no, maybe not perhaps, my favorite chapter, because I was able to interview in a qualitative fashion several nursing instructors who have been flipping their classrooms. So that chapter really talks about their ideas. Each one of them has a chart of flip tips. It's just a great chapter. Some really good exemplars of flipping. So moving on to think about how could we use this text. I really think the best way would be a pre-read and then to use it as a guide prior to flipping your classroom. I think that might be the smartest way, but I bet there are some of you out there who have already flipped the classroom and not had success. You know, similar to my experience, I was like, hey, this is great. I'm going to do it. I'm all in, and then my students completely rebelled on me, and that whole experience is in the book, and I learned so much from it. My students are so wonderful. They teach me things every day. I'm so grateful for that. So if you have had that experience, I don't want to guarantee, but I'll almost guarantee that this book will turn that around for you and make you see, wait a minute, okay, I just need to do this step or that step. And then I would consider using the model in the book as a guide for flipped classroom preparation, because it's really one of those models that allows you to see something from each side of the playing field of teaching and learning so that we can include our students in what we're doing. So some of the instructor feedback from the text that I had been given from JBL, one of the feedback quotes was that it's a great introduction of the flipped nursing classroom, and that I was able to make some connections with essential nursing documents, you know, like the IOM work, the, you know, AACN, for example, in Essentials. And really about that chapter 1, I think this quote is talking about a thought-provoking discussion as to why we should even think about flipping the classroom in the first place. Because I don't know about you all, but change is difficult for me. And if I can just keep, you know, floating down that river without any rapids, it seems pretty nice to me. But at the same time, we wouldn't have any fun or get anywhere if we didn't float down a little bit farther down toward the rapids. So the next instructor feedback was talking about that it's simply written, and it's really written for you. Like I was having a conversation with my fellow faculty members over a cup of coffee. That's how I wanted it to be, a little bit more conversational. I think that this quote talks about strong arguments to support restructuring the way that we educate nurses, and thinking about some of the big literature themes that we have in nursing today: cultural competency, adult learning and responsibility, and development of those clinically competent and critical thinking nurses. I think that's very, very important, and we're putting more onus on the student to learn, but we are not stopping the teaching portion of what we do. We're just making the learning experience more applicable for our students. The next slide, I want to introduce the model to you. It's called the intentional instruction model instead of the flipped classroom model. for a couple of reasons, just because Kat Johnson and I really believed that we wanted to have instruction that was intentional. We didn't want to just stumble in the classroom with an old PowerPoint from last year and, you know, hope we made it. We wanted to have an intentional experience of teaching and learning with our students that would really help us guide them through and really learn and understand and not have kind of a mental brain dump at the end of the semester. We wanted them to retain this information. So as you can see at the top with the green triangle, the learning objectives really should guide everything, and everything should flow from the learning objectives. The offload content, as mentioned in the book chapter list, is what we want the students to do before they come to class, and the in-class activities are the other piece of that big portion of the student learning. So the learning objectives, of course, the faculty will set those ahead of time and will write them out. Then we have to think about what do we want our students to do before they come to class, which are those lower ordered learning objectives that we're all familiar with from Bloom's taxonomy. So anything that you want the student, maybe rote memorization, for example, that they can learn without putting a lot of pieces of material together to critically think, have them do that in the offload. And then the in-class activities are how you're going to use that valuable face-to-face time with your students to engage them, to teach them, and this is where we want to work on those higher-ordered learning objectives. And evaluation, of course, moves across offload and in-class activities, and since those flow from the learning objectives, it also includes, did we meet the learning objectives? I think one of the biggest changes in the second rendition of the model from the one that I had developed earlier with my colleague Kat Johnson is that I have learned really the hard way that partnering with students is a critical component to the flipped classroom, particularly in nursing education. I'm not so sure about other professions, but I know that we have very intelligent, very strong-willed, strong-minded students, and they want to be a part of. And if they are a part of, they are more engaged in the learning experience, and I have found that critical element in the middle there, partnering with students, can make all the difference. So moving on to the experiences of flipping, as I had mentioned, my first flipping experiences were not the greatest, so I did learn a lot of lessons the hard way. And really, to be honest with you, I wanted to just flush this idea altogether and go back to lecture because, hey, I had been lecturing a very long time, 15-plus years. It was very comfortable for me. I had a lot of really pretty PowerPoints that I wanted to use. But I kept moving back to the idea that, gosh, I don't think my students are learning when I do that. I think I feel like I am teaching them, but are they really learning? So my goal is to have other nursing faculty learn from my mistakes and really consider if you think that your student is learning in the lecturing classroom. And I think there are a lot of students that can learn very well by lecture, but even the student who's the most engaged with lecture is going to zone out from time to time, and we know that from the way that the human brain architecture is actually structured. And one thing that I wanted to share just in the seminar, or in the webinar that I did not share in the book is that I really felt at the end of every lecture drained. It's like it was a race for me to empty all of my knowledge of any given topic into my student's brain, and I had to get that done within a certain time frame, and I couldn't get through my slides, and I just felt very, very pressured. But after I've used the flipped classroom, I feel more energized. I feel really excited about what the students have learned. And that was another reason why I wanted to continue with the flipping method, because I think that that is telling that if we are working harder than the students are working, there is something wrong there, and that we need to be more engaged together in the teaching and learning circular pedagogy structure rather than us just being the sage on the stage trying to dump our knowledge into students that may or may not be listening. So moving on about trying to avoid some common challenges, I just wanted to kind of pull some of the main themes out of the book is that preparation is really important for the flipped classroom. So you have to prepare yourself as a faculty member, but you also have to prepare your students for flipping. By and large, I know in where I work and where a lot of my colleagues are working that are doing their flipping, they say the same thing, that most of the instructors that teach these students, and it doesn't necessarily have to be within your nursing faculty, it can be their prereq courses as well, are teaching by main lecture. So this is what students are used to, and as we had mentioned before, change is difficult and not always so readily accepted. So we have to really think about how to prepare our students for flipping, and there are some great ideas in the book. Some that are my own, some that I got from some flipping colleagues in math. Jerry Overmeyer, who is a great flipped learning instructor here on our campus, that'll help you do that and make it real practical, easy, and quick. And I think be ready for some common complaints and small setbacks. I think that happens even when we lecture, you know, so we have to realize that sometimes they might have been there anyways, the complaints and the small setbacks, even with a lecture-based course. So help your students to learn how to study and, more importantly, how to learn. So there's a little section in the book about talking to students about how to watch the videos. So you don't put on the video and then go play with your dog or play with your kids or try to do your dishes or whatever. Really treating that like the offload class time it should be, and then maybe even giving them a handout to help them stay engaged, that sort of thing. And those videos need to be short too, like maybe 20 minutes or less, and the book really talks about that as a really important pedagogical aspect of the flipped classroom. Evaluating the entire process, of course, sometimes I think for me, maybe not for you, but I think, okay, good, I'm done, I taught the students, but there's that evaluation loop that we need to be sure to close. And I want to say, you know, I really want to stress, remember that novice to expert takes time, and you're not going to be good at this the first time out of the gate. It really does take some time. Think back to maybe the first time that you lectured and you thought, oh boy, that could have gone a lot better. I think the same thing is going to happen when you flip the classroom. So we have to be more easy on ourselves. So how do you get started flipping your classroom? Get yourself some good resources. I think this flipped classroom text is a great resource. I'm a little biased, perhaps, but I think that it's a really good kind of structured. I'm very type A, so I think they're very good, you know, textbooks for people similar to me that are just like, bing, 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 I need to know what to do, and I need to know how to do it now. Also, instructional design teams on your campus are really good resources, and I talk to a lot of people across disciplines who are flipping, people from math, people from the other sciences, people from the business school. It's been very helpful to see what they're doing and how transferable their ideas are to my own nursing classroom. I think there are several websites and blogs for the flipped classroom, and I'm going to try to update my blog every month and try to make sure that there's something new and fresh on there for you to look at every month. There are a lot of tutorials for any kind of video capture software you're going to use for your offload learning, and I would recommend looking at those. So I didn't, and I think it would have saved me a whole lot of time. And then I would say start slow, proceed when successful. Don't flip a whole course at once like I did. Just flip one unit and start with a subject that you know really well, because you are going to be that guide on the side, and students are going to be asking you a lot of questions about that one particular topic. So try to flip just one, and then you can move on when you're more successful. Once again, try not to be too hard on yourself, because this is a process of learning a new pedagogy. And then keep flipping. Remember, time and space elements within a flipped classroom are very important, and that's what my blog post is about today. There are some good strategies in the book to help you prepare your time and think about extra projects and things for students to do if you run long on class time, or if you run short as well. Make sure to evaluate and revise the next time for your flipped class. I do that right after the flipped class now. I think about it right then, because if you move on to other things in your day, sometimes you forget about what you would have done differently, and then the next time you flip that class, you think to yourself, oh yeah, I was going to change that and I didn't. So try to do that right after. And then really release your creative self. Be creative and think about ways that you might be able to capture each learner's attention. I think this is so exciting. This is what we want to do as nursing educators. We want to make sure that we actually teach, you know, and that the students actually learn. I think that's one of the most exciting things about me being able to just face-to-face talk to my students and say, whoa, I think you're off track there. Let's think about it this way. And you're more of a coach. It's just a wonderful way to teach. And as the model shows, it's important to partner with those students and help them create a shared learning environment with you instead of you dictating to them. I think that's very important. And then your long-term flipping goals. When successful, I think you can flip the entire course when you're ready, but go slow at first. consider collecting data. Please consider collecting data and disseminating that data for the scholarship of teaching and learning for the rest of your nursing colleagues out there. We really need to get more of this literature into the mainstream so that we can start to show that this really does work just as well as lecture, and most of the time I think we're going to find that it works better, especially in terms of retention of material for students and student satisfaction long term, maybe not short term. And keep in mind that the flipped learning is always about the way that we can maximize that time that we have with the students and be more effective teachers. And isn't that what we're all here for? Thank you very much.
Karen, thank you for that really thorough overview of flipping the classroom. Before we move on to the question and answer via the telephone, I just wanted to invite anyone who's on the line. You can also ask a question via the chat. And for those folks who want to learn more, you can visit go.jblearning.com/flip to actually purchase a copy of the textbook and learn more about flipping the classroom and some of those points that Karen discussed in detail. We'll also post the webinar to our YouTube channel, so you can find that there within about 24 to 48 hours. And Karen's also doing a blog post for us monthly, and we'll share different tips and tricks that she's learned on flipping the classroom. You can find that on the JB Learning blog site as well. Karen, we have just a couple of questions that have come in via the chat. I think one that came up that's particularly interesting is regarding students, and how do you get buy-in from students on flipping the classroom?
I think that is an excellent question. And like I had mentioned during the webinar, I did this the very wrong way the first time with a group of graduate students who were in one of my FMP courses. And I just went in and said, all right, this is the new thing we're doing. You know, aren't you lucky to have me do this to you? And they were very resistant. I even had comments from my students such as, my gosh, I'm not sure what we're paying tuition for if you're going to make us do all the work by ourselves. And it really created a very valuable discussion about what is teaching and what is learning. And then that also led me to put into the model that partnering with the students, and I think that is critical. I think if you allow the students to develop the structure in which they're going to be able to learn the content, they are going to be much more invested. I have a lot of faculty that are concerned, and this might even be a question that comes up in the queue, how do you get students to come to your class if you're putting your lecture online, I don't put my lectures out on YouTube for anybody to see. They are specifically loaded into the learning management system only for my students, and I don't load videos that are other people's videos, even though I think some people do such a better job than I do, and they're really cool looking videos. My students have told me, and I put this in the book as well, we don't care about how cool it is. We want to hear you. We want to know what you want us to know. You know, you are our instructor. So I make all my own videos. I load them up only for them privately so they know that they're the only ones that can access that. And I think that helps a little bit. But at the same time, they learn very quickly. My students learn very quickly that if they don't come to class, that they are missing out on the most valuable part of the learning experience. They're only getting a chunk on that video lecture, and then when they come, they get to apply it, and they get to ask questions, and they get to simulate a clinical learning environment before they actually go and interact with patients and preceptors. And I think once they are able to see how that works and that they are able to learn more, then the buy-in is pretty easy. I still have one or two students, in any given semester that is not happy with the method, and I hear about that sometimes verbally from them, but sometimes on my evaluations afterwards. Don't we all love that? But at the same time, I think back, I probably had that same, percentage of students that weren't happy with my lecture as well. So, and I'm not so concerned about students, coming to class. If they are paying for the class and they want to learn, they will come. And so I really don't have a problem with students not coming to class. But I think our classes are really not just educational, but really fun, and they really are applicable. And I think that that's what students are really thirsty for, is a classroom environment that allows them to really engage their brain and think about what they're going to be doing in clinical versus sitting unengaged in a lecture. I hope that answers your question.
Thanks, Karen. We had another question come in that I think was equally as compelling. I think you just mentioned that you let students develop the structure of the class. Can you expand a little bit more on what you exactly mean by how the students are doing this?
Yes, that is a really good question. I'm so glad that somebody answered this. I think maybe some of the best lessons that I've learned about being a nurse educator have come from my lessons being a parent. And I don't want to make that sound demeaning in any way, but I've noticed that with my kids, if I give them a certain choice, like I say, you can do A or B, these are your choices, but I still have really ultimate control over what those A and B are and what direction. So, for example, you know, in one of my classes, I allowed the students to either do case study or written presentation, for example. Or I say, you know, do you want more visuals or do you want more audio, or that sort of thing. And I try to have them do a learning inventory. However, I'm finding out that the generation that I'm teaching now, the 20 and 30-somethings, really want more audio visuals and like interactive stuff. They don't want a whole lot of sitting in your seat because their environment around them is more engaging than that. So I give them a choice of certain activities in the classroom and certain assignments that are all okay with me. Does that make sense? That I believe as the instructor are all going to meet the learning objective and give me an assessment that I need to find out if they're learning or not. So I might give them a choice of 3, but any of those 3 would be fine with me. So I just let them choose. And then as they choose, I put them into groups and have them work together on that sort of material, if that makes sense. And I did this in an undergraduate class first, and it worked so well, and they were so engaged. I talk about it in the book that one of the instructors that taught the course before me said, boy, this is just not sexy material, Karen. I'm not sure what you're going to do with this. I always get bad evaluations. It's not fun to teach, you know, core concepts and stuff. And I was like, oh, okay. So I thought, why is it not sexy for them? You know, that's just such a weird term for me. But I just thought, well, why is that? And so I went and asked them. And they said, well, we want to learn it this way, and we would want to do this, and why can't we do this? And I thought to myself, why can't they do that? That's a great idea. So sometimes I also take suggestions from the students and say, hey, if you can find a good way to meet these learning objectives and you have a different way to do it, come to me, and I will definitely consider it. And I think making that environment more fluid, but also having ultimate control is a nice combination for me that I have found, and it really does engage the students in their own learning.
Thanks for providing that additional feedback, Karen. I think that was really useful. At this time, I'm sure that we probably have a few people waiting on the line to ask a question. So, Katrina, do you have anybody that you can put through live to us?
Yes, there is a question from the line of Rebecca Carlson.
I'm wondering if you're seeing success with theory classes that don't have any practicum component.
Say that again, what kind of classes?
Just the theory classes, you know, not a clinical class, just theory.
Yeah, and actually the one example that I was talking about, Rebecca, was an undergraduate class where I was having to teach core concepts. One was evidence-based practice. I'm thinking back, culture, teaching in nursing, like teaching our patients. Those sorts of main concepts, professionalism, I'm trying to think of a couple of other ones. Those kind of main core things. I think there was even a chunk of theory in there. It's been a couple years since I've taught it. But that was the course where I just said, hey, you know what, how would you want to learn this material? And the other kind of caveat to that was I was very unprepared for that class. I'll just be really honest. We had somebody leave our university unexpectedly, and they said, hey, we've got this extra class. You're the more seasoned person. You can handle this. Here, take it. And I was like, it was, you know, what, December, I don't know, 20th or something, and I had to start teaching it January 5th. So a little bit of a panic button there, and then I thought to myself, well, maybe I'll just go and see how the class responds to this idea of let's partner and see how we can learn this together. Because that is material sometimes it's not the you know, most interesting to them. You know, I mean, they're not up you know, doing chest compressions and learning how to do all the great skills stuff that sometimes is so, you know, intriguing and really interesting to students. So yeah, I have used that in theory courses. I've used it in an evidence-based practice course, which worked really well, and just letting students pick their own style of presentation, and if they wanted to attend an evidence-based practice committee and have, you know, bring back minutes or something, to do that instead of doing other, you know, other written work. And I've just found that students tend to be more engaged and learn better in that way if I let them make some choices on their own.
Great, thank you.
Thank you.
Okay, thank you. I know that we do have a couple of other questions, Karen, that have come in via the chat. The one is asking, or we have actually received this from a few different faculty members, what class size do you find is optimal? And then secondarily, we have another instructor who has 50-plus students and in her class, and the length of the class is 4 hours long. So don't know if you could comment on either of those 2 points.
Yes, that is an excellent question. I find, obviously, we all like smaller class sizes, right, because then we have a better opportunity to engage with each individual student. But one thing that flipped learning does is allow more time for maybe student groups to work on projects in a group, and then the faculty can float around and try to get to each individual group. I think the larger the class size is, the harder flipping is. I'll be really honest with you in my experience. Just because it's harder for me to get to each individual group. I find that I have to be a little bit more creative in my in-class activities, and I have to find some activities that students do kind of largely on their own and then report back type activities while I work with the other half of the group, and then we switch and work on with the other half of the group while the group that I was more engaged with earlier is doing more of their own stuff. I think grad assistants are really helpful if you can get grad assistants to help you. One year I knew I was going to have a bigger class, and I had a faculty member that I know and love who's not only my colleague but my friend, and I asked her to help me with my class because I knew I was going to have a lot of students. But in reciprocation, then I helped her with her larger class when she needed it. I think we have to be sort of creative, you know, in the way that we work on those sorts of things, and try to make our in-class time a little bit more fluid, and that is harder the larger the class size gets. My grad classes I like to flip the most, and they're around 20, 25 students. And I also like to flip with an even number. I found out that I'm very, very strict about this. It's hard because when you have an uneven number of students, you can't break them up into even groups and do things like jigsaw. So yeah, I think that the last chapter in the book might be helpful for this question, in that I have a colleague that is flipping with pharmacology, a very large number of students in that group, and she has come up with ways to flip it and be very successful with that. So I prefer, though, 2025. That seems to be a really nice number, and then it doesn't get quite so chaotic and out of my control.
Thanks, Karen. And Katrina, do we have anyone else on the telephone line for questioning?
No, ma'am, there are no questions.
Okay. We do continue to receive some over the chat, so if anyone has those, we'll get to as many as we can. So a couple more for you, Karen. I think this is just a follow-up question to when we were talking about and addressing students determining the structure of the classroom. We have one faculty member that is just asking, I think, a clarification question. Were you referring, I think, in your answer to the fact that you might have 3 groups using different learning methods, different methods to learn the same content?
Oh, yeah, thank you for asking for that clarification. What I was talking about was I have maybe 3 different assignments for the year that they would choose from at the beginning of the year, and then they get to choose which assignment that they most align with. You could also do it in the way that you're talking about, though, if you're thinking about, oh, this group needs more audiovisual, this group needs more written word, that sort of thing. But by and large, I think you'll find that most of the students are going to move to the audiovisual interactive type methods. This is where I've used my interactive PowerPoint quite a bit, where it takes a really long time to create them. But it's a clickable PowerPoint where they can only move forward in the PowerPoint if they click the correct answer. So, for example, in physical assessment, if I'm talking to them about the APETM sites for auscultation of the cardiac sounds, and I say, where are you going to listen over the pulmonic area, click on the button, and then they have to click on the one that is the pulmonic area before they can move forward. So those are some of the classroom activities that I have them do to help solidify their learning and then have them be more engaged in a case study with me. But what I was talking about before is if I had 3 different assignments, like maybe one is a paper, one is a community-based learning, service learning type project, and one is maybe a presentation to a group outside of the university or even inside the university that needs information, then they could choose which one of those that they would want to do. And then all of the students that chose the service learning would work together on that project or that sort of, I'm trying to think of the word I'm talking about, that assignment. So that's more what I was talking about. So it's a priori. It's before the students come to class, then I have a few things that they would be able to do. And then, like I said before, some of my best ideas don't even come from me. They come from the students, where the student says, hey, you know what, I would like to do this at the Global Refugee Center. Could I do that for meeting these objectives? And I think, yeah, you know, that'd be a great way. And if they can show me how they can meet the learning objectives, then I not only let them do that, but then I use that idea for future classes. I hope that answers the question.
Great, Karen. That was very thorough. I think that most likely answered the question there. And another question comes in from an instructor, and I'll read this right from the chat. It's a little bit lengthy. I was told by an NCLAX review instructor that it is frowned upon to use games in the classroom. I was teaching and using Jeopardy in my classroom to get students involved in learning. Is this now not what we should be doing?
Oh, what a great question. And you know, over the years, I'm always careful to consider many sources before I decide something is either, you know, quote, good or bad, because I think sometimes we latch on to something somebody says and then we're like, no, I'm never going to do that again. I don't think games are bad in the classroom. I prefer not to do games for a couple of different reasons. One is they tend to get the rote memorization or lower ordered learning objectives, and I'd rather students do that before they come to class. I want to engage with them when they are really struggling with why, you know, does a CHF person have fluid in their lung? I don't understand why we have to worry about their IV rate, you know, that sort of thing. I like to work with them on the higher order objectives when I'm in class with them. So I would take the Jeopardy game and make that something that they would do on the offload, like maybe watch a 10-minute lecture video and then do the Jeopardy game before they come to class. The other reason that I don't like Jeopardy, well, not just Jeopardy, but gaming, is that most of the games, and I'm sure that there are some great games out there that I don't even know about, but most of the gaming that I have been engaged with in the classroom with my students only engage 1 or 2 students at a time, or they require us to put a group of maybe 5 students together, and only 1 or 2 of them tend to be engaged at any given time. So I really want to think about that intentional instruction where I'm really making sure that every time I have the students with me face-to-face, I am doing something that is promoting their learning beyond those lower ordered learning objectives.
I think that's a great point, Karen. Thank you for answering that.
Mm-hmm.
And one of the last questions comes from an instructor who sounds like they're teaching online courses across various campuses, and it was asking how you might flip the classroom in that setting if they're using IP video to conduct their courses, and again, it's across various campuses.
Right, and this is an interesting question that I get quite often. I don't have the best answer for this question, because when we think about the idea of the flipped classroom, we're really talking about face-to-face time with the students. And I think that when you are in an online environment, you're not as readily able to engage with students, or you engage with them in a different way than you do when you're in a physical classroom. But I do have some colleagues that have given me some good examples of this from English and our education over here at UNC. And these instructors will use the flipped classroom by just making 2 times, and these are asynchronous online classes. So if you have a synchronous time that you're all meeting, essentially it can be very similar to what you would be doing on campus, except for the really fun things sometimes that you do, like creating a concept map together on a big sheet of paper, aren't available in an online learning environment. But what they do is they set up two different times that they will open a online session that's a kind of like face-to-face. We use Collaborate with Blackboard. I think there are some other things through other learning management systems where they get on and they meet with a group of students and then they engage with them in that way. Some other faculty have used small groups in their learning management system online and used the flipped method to try to engage with them in the case study while they're being present, present with them online, versus just having them do the videos for the rest of their learning. I love teaching online. I really love the asynchronous nature of it, but the asynchronous nature of it makes it more difficult to implement some of the in-class type activities that you would do in what we have come to know as the traditional flipped classroom.
I think that's really useful information, Karen. Thanks for sharing your perspective there. A couple more questions. Can this be used to teach both concept-based courses and also those courses that are more like pathophysiology-based, such as pediatrics and also med-surg?
Yeah, great question. I think it can be used to teach anything, and some of the best evidence of that is in Chapter 2 of the book about all of the evidence out there from all of the different health professions that are using this. They're using it in math, they're using it in English. Of course, we know it originated in a high school with chemistry and biology classes. So I think that you can use it to teach anything, I really do. I think the main thing is to remember the lower ordered learning objectives that students are likely to learn on their own should be in that offload. And then the more complex things, you want to teach them in the on campus or the face-to-face time. That's kind of the basic. So whatever those objectives are. And the other thing I write in the book is that, I don't believe lecture is a four-lettered word. Sometimes students need a lecture, but I don't believe anymore in the 3-hour lecture. In fact, when I'm working with my students in the flipped classroom and I'm noticing that they're all getting a concept or an idea incorrect across the groups, and I'll do it like a timeout and do a just-in-time teaching where I say, okay, wait a minute, stop. Everybody is thinking about gestational diabetes like type 2 diabetes that's pre-existing in pregnant women. That is not what we're talking about here. And then we have a little discussion point about what's the difference between gestational diabetes and diabetes that women have before they become pregnant. So those sorts of things where you're just kind of picking out things in the classroom like, whoa, just because a woman has diabetes during pregnancy does not mean she has gestational diabetes. There are different types. So those are kind of learning moments that you can pull out and highlight with little mini lectures. So I don't think that lectures are bad. Even my colleague, Kat Johnson, who is in the last chapter of the book, she readily admits that in her pediatric cardiac lecture, she cannot do any other thing than lecture with that, just because all of the different ways that the cardiac structures can be have problems congenitally, she has a hard time showing them any other way. So we have this little friendly argument, because I'm like, yes, you could do that on video, I'll show you how. And she's like, no, I just prefer to lecture on that one. And that's her choice. And I think that she feels more comfortable with that material and feels like the students learn. And by all means, that's what we want. We want the students to learn. But yes, I think any content can be taught with the flipped method.
Thanks again, Karen. And I think we just have one more question before we close out this session today. What can you tell us are some of the ways that you've measured success besides using student feedback? I look at the tests, definitely the test scores. I think that there needs to be a study similar to Annie Henderson and I did a cognitive load study on the interactive PowerPoint, the interactive methods in our physical assessment class related to just a handwritten case study, and we found that the students who had the interactive method retained far more of that material 2 semesters later. So I think we need that sort of research that shows not only like at the moment what has happened with the flipped classroom and our students learning, but also long term. I have found personally from year to year, my students' test scores seem to be higher, but we all know we have to be careful with statements like that because it may not be causal. I may have one group of students that were just maybe higher achievers or had higher intelligence level from one semester to the next. It's really hard to do this type of
in-time educational research. But one thing that I do for evaluation is evaluate myself and evaluate the way that I taught. I'm a very self-reflective educator, and I like to sit down after I teach and think to myself, okay, what went well, what didn't go so well, how can I change it to make it go even better the next time around? And I think that that's one thing that has kept me not burnt out over the years, is that I always like to change things. I don't just, leave it lay and say, well, that was a bomb, I'm never doing that again. I try to think about how could I do this in a way that makes it better. Another evaluative component is that I have other faculty help me with my flipping and then therefore give me suggestions. And that is a really nice piece of evaluation as well. So I think that the evaluation chapter will show all the different ways that we can evaluate. The other thing that I've started doing just recently is making sure that I review all of the videos that I had done in previous years and be able to edit them and update them. And I think that's a valuable part of evaluation as well, especially with the quickly changing healthcare environment that we are working within. Then we need to be updating things on a regular basis. So we can't use the videos from 3 years ago and just sort of slide them in there and hope that hope everything was done correctly. And that is a very big temptation when you have a lot on your educator's plate.
Karen, thank you so much for your time today. We really enjoyed hearing from you and, for taking all the time to answer our faculty questions. If anybody would like a copy of the text, there are some instructions on how you can purchase it if you want to share the webinar, or if you'd like to, replay this again on your own time. We definitely have a YouTube channel if you just want to find us there. And I think, as I mentioned earlier, Karen will be writing a blog post for us once a month, and you can find that on the Jones and Bartlett Learning blog. And we'll be sending out more information after the webinar so that you'll be able to access that. Well, this concludes today's presentation, and again, thank you to Karen Hessler for spending this hour with us. Take care, everybody.